Hey, today what we're doing is we're going to repair this nice patient's earlobes. She used to have ear gauges in them. This is the size ear gauge she used to have in there, but it wouldn't fit in there anymore because the skin has shrunk up a good bit, but we want to remove that hole. If you can imagine, if we were just to remove the skin here in the middle and suture it up, it would make the earlobe point, so we don't really want that to happen.
Definitely don't want you to look like an elf, if we can avoid that.
Therefore, instead of just removing the hole itself, we're going to actually remove a wedge of the ear. That way, when this part comes to meet this point, it'll look great.
So how long does she have to wait to get her ears pierced?
We usually ask that the patient waits about 2 months, and we ask them to come back to us because we want to re-pierce it rather than somebody else re-piercing the inside. This procedure is done under pure local anesthesia, which will numb up the earlobe, but it'll also have epinephrine, which constricts the blood vessels, minimizes bleeding. Pretty cool. You can already see that the epinephrine is working. Well, maybe y'all can't see it, but the epinephrine, which constricts the blood vessels, minimizes bleeding, it causes the skin to blanch. And because we see it blanching, we know that it's working, and we know that she's probably already very numb, so we can go ahead and get started. I've got a tongue depressor behind the ear just to stop the knife from plunging down into the side of her face, and we're going ahead and making our incision now.
Do you feel anything?
Not at all.
Good.
The miracle of local anesthesia. Just going down and making the incision at those angles that I showed you previously.
Looks like a slice of cake.
Right. So here is the piece that we'll be removing, and then we'll sew this edge to that edge. Just finishing up the incisions I made, and we'll remove this now. And you can see the piercing here that we've removed. We've removed the gauge opening, and now we're going to reapproximate it, starting at the this point down here. Just sewing up the back side of the earlobe now.
Alrighty, we're all done. Bilateral ear gauge repair. Was that easy for you?
Very easy.
Ah, love that.